Welcome back to Big Country Politics on KTAB.
Well, hello and welcome to this week's Sunday Conversation here on Big Country Politics. I'm Manny Diaz. This week our special guest is Cynthia Frazier. She is the Program Director over at the Abilene Recovery Council. Miss Cynthia, thank you so much for joining us today.
Certainly. I'm glad to be here.
Yes. Well, you know, this coming up on KTAB, we are airing a fentanyl special on Thursday, August the 8th. Will be in place of KTAB News at 6. You'll be part of a forum, West Texas, Abilene, the Big Country, fentanyl, opioids. Those elements are here. We've heard Sheriff Ricky Bishop address that multiple times. Your organization sees a lot of that. Before we kind of get into you know how you guys are really addressing this, tell me about yourself and tell me about your title as your position as Program Director at the Abilene Recovery Council.
Sure. I've been with the Abilene Recovery Council almost 5 years now. I started as their data coordinator. I love numbers and doing deep dives and research. And then about a year ago, I became the Program Director. I'm the Program Director for our Prevention Resource Center, along with our Community Coalition Partnership, which is who purchased the Narcan vending machine.
Wow, and we'll touch on that because that's a really cool thing that got put up earlier this week. Tell us, I know this may be just the most simplistic question, but for those out there who hear the word fentanyl, hear it sprayed all over mainstream media, throughout the internet, social media, what is fentanyl?
Okay, that's a great question. Fentanyl is a completely synthetic opioid. Opioids are used to control pain. Fentanyl is a very high-grade use for pain. It is very safely used in hospitals and by doctors. Cancer patients use it. They use it in medical procedures. I recently actually had fentanyl used during a procedure of mine, but they are micrograms versus the milligrams that are being mixed into our illicitly made manufactured fentanyl that is being brought in and mixed in with our fake counterfeit drugs. You've been
in this position helping people for a number of years now. Tell me about, when fentanyl, it started to become a true concern here, that we're seeing the negatives of what this drug can do. When did that become evident to you and your group?
We have been hearing about fentanyl in other areas of the country. We knew we were starting to see some higher doses here, some more overdoses. We learned of an overdose death in a northern county, and then there were several arrests here locally. There was some overdoses that the Abilene Police Department asked us to speak on in different interviews, and that was several years ago, and we just started learning more and more and seeing it increase greatly within our community and within the Big Country.
So it's here now.
It is here, yes.
So what you hear about on the Texas-Mexico border or being infiltrated from somewhere else or being brought in, that is officially here.
It is here, and we know that it can be anywhere, especially since COVID. The drug dealers have been able to utilize social media and be able to get their drugs a little bit more widespread. They've got a bigger audience. They can have it delivered right to your house, whether that's somebody they're selling to that brings it to you or is put in the mail. Nothing says illicitly toxic medication when it's mailed to you, or you got it from a friend who thinks that what they bought was perfectly legal and was the real thing. That's probably the most dangerous, is someone handing you a pill that they say this is the real thing. I know it is. I got it from somebody who knows it's real, and then it turns out it isn't.
Speaking of that, you mentioned a story of a death that occurred in a northern county or in our area of a young woman who, she basically consumed fentanyl. Did she know about that? Tell me about that, because that's scary all into its own.
It is. We learned of a story of it was 3 overdoses. 3 people overdosed. 1 did not survive it. She was a teenage girl. She did not know she was taking fentanyl, and we happened to hear about it. We went up and spoke to the investigator in the county that was doing that. The toxicology report came back several months later, and she ended up having 5 times the potentially lethal dose of fentanyl in her system.
5 times.
Right, so she had about 10 milligrams. 2 milligrams is a potentially lethal dose of fentanyl, and she had about 10 milligrams.
And we're talking about just a small amount. It's less than the size of a penny.
Oh,
right
definitely.
around.
It can fit on the tip of a pencil lead, or it's about 4 to 6 grains of table salt.
And that's what was killed her 5 times over.
Yes.
That's wow.
Yes, it's very sad and tragic because a lot of people, it's the leading cause of accidental overdoses in the United States.
How much are y'all seeing that here in Abilene now with these accidental ODs?
Well, unfortunately, because the state does a very good job of suppressing to try and keep private information, and so if there's less than a certain number, those numbers are suppressed. I was looking at it just today, and we know that in Taylor County, between 2011 and 2022, there were 80 opioid overdoses, whether that was fentanyl or prescription opioids, whatever kind, there was all opioids. We've had overdose deaths, that same time period, of 192 complete overdose deaths, whatever kind of medication that was on or whatever kind of drug that was taken. But fentanyl is new that they're really doing on a dashboard, and so it's a new process that they're keeping in track of. So we really can't find it just locally as far as Abilene statistics, because some of those numbers are suppressed due to the number that have died from their overdoses.
Why do you think the state is trying to suppress some of these statistics?
For the person's privacy, for the family's privacy. Because if you know that, say that there's been 25 deaths, and you do some hospital research or you see something in the paper, you can kind of go backwards and you might be able to find who that was. And so they do that for the family's privacy and for just for safety of the people who have passed from that.
All righty. We're going to take a quick commercial break, but when we come back, we're talking about what the Abilene Recovery Council is doing to be proactive about fentanyl here in Abilene, plus how it compares to other harsher drugs. That and more right here on Big Country Politics.
Welcome back to Big Country Politics on KTAB.
Well, welcome back to our Sunday conversation here on Big Country Politics. This week our special guest is Cynthia Frazier, the program director of the Abilene Recovery Council. Ms. Frazier, we talked, certainly how fentanyl is really, it's here now in segment one. Tell me, I know heroin, it's a natural type of drug. Methamphetamine, on the other hand, is not meth, because it's built like it's constructed like fentanyl in a lab,
right,
wherever it may be.
Right.
How do you think that ranks in terms of potency when it comes to fentanyl, meth, and heroin in those realms there?
The one thing with any kind of opioids is especially with fentanyl, the withdrawal symptoms can happen so very fast. And so you are wanting more very quickly. And it really depends on the person's chemistry and their tolerance, their body chemistry, and if they've used different opioids or different medications or different drugs before. We do have a large methamphetamine issue in all of our surrounding counties, from what I've been told from different probation officers and different people who deal with law enforcement. But opioids are such a strong hold on someone, and because it can be that you've gotten it perfectly safe, you've gotten it through a prescription, and then you reach out, you run out, and the doctors won't give you more. And so some people have reached out to street drugs like heroin to give them that same effect. And unfortunately, we're seeing fentanyl laced in with everything.
Has it replaced meth? Has it replaced heroin?
I don't know if it's replaced it. It's a different type of drug, and every person has if they have a substance use disorder, what they kind of want to get and what's easily accessible. It really is ease of access. And unfortunately, because we have seen fentanyl and with methamphetamines, I had a probation officer tell me one time, you can't even trust your drug dealers because you never know what's going to be in them.
As we get into what you guys are doing to be proactive about, use and things like that, how difficult is it to overcome addiction when it comes to opioids, when it comes to drugs like fentanyl? How difficult is that?
I think every person is different. Depends on their path of recovery, their path of treatment. We see people for opioid use disorders, and we try and get them into treatment or into a medicated assisted treatment program. There's so many different ways that you can. There's even medication that you can take called Suboxone that's safe when someone's pregnant. And so someone who may have a substance use disorder for opioids and that is pregnant, they can use Suboxone, which is perfectly safe for them and the baby, and they can take that to block that desire for opioids. And so it really does help them overcome that. And then there are so many different pathways to recovery. For each person, it is very personalized.
Earlier this week, y'all unveiled a Narcan vending machine,
Yes.
the first in the city, which is, it's very nice to see, an organization doing what you are doing in that aspect. Now, you're not the only ones to really give out Narcan for free. There are others,
Right.
but this is something that can be, that somebody can get 24/7, 365 days out of the year
Yes.
when it's available. There are boxes in there.
Right.
What was the genesis of that? Tell us about this.
This wasn't my brainchild. Our previous coalition coordinator came up with this idea that our area needed a Narcan vending machine. We went through the process of discussing it with our agency, CEO, our director of operations. We talked to the state and we started pricing them. The state gave us the green light that they agreed this was a good environmental change for us. Our grant does require us to do environmental strategies, and so this was one of ours. And so we were able to talk to Book Therapy and got their blessing to have it outside their building. We felt like that was a good centralized location in Abilene, in that area. And so we ordered it, had that thing brought in, and we unveiled it this week, but it's actually been up and running since before 4th of July. We wanted to make sure that it was filled and accessible to anybody who needed it during that holiday weekend.
Well, Cynthia, thank you so much for joining us today.
Thank you for inviting me. I've enjoyed it.
Yes, ma'am. For Cynthia Frazier, the program director at the Abilene Recovery Council, I am Manny Diaz. This has been another Sunday Conversation right here on Big Country Politics. We'll see you next time. God bless.
Thank you, Manny. And KTAB will have a special program that we're preparing on this fentanyl crisis. The KTAB News Team has been developing stories with local people facing and fighting the drug problem. It will air this coming Thursday, August the 8th from 6 to 6:30. And then following that special will be a forum with local health, law enforcement, and social agencies directly involved in confronting the fentanyl crisis.